Jason Bradshaw says he loves teaching science in the classroom, and educating during the pandemic has taken a toll.
You feel like you're talking to a computer screen, and after several weeks of doing that, I think it really does start to get to you.
It's not only his mental health that suffered, he says, but his students as well. And while experts have warned of the havoc COVID-19, lockdowns, and fear would wreak on our psyche, a task force commissioned by the medical journal The Lancet instead uncovered a surprising shift.
Overall trends seem to show that by and large rates for psychological distress went up and then by and large went down.
Vancouver psychologist Lara Akinen and her colleagues collected data from close to 1,000 studies across 100 countries. One poll in particular of more than 100,000 people worldwide revealed in 2020 most rated their lives on average as a 5.75 out of 10. The exact same score as previous years.
We aren't simply at the whim of viruses and any forthcoming natural disasters, but that we can mobilize, that humans can perhaps withstand these pretty drastic short-term alterations to our living styles.
But Akinen says not everyone had the same experience. Individuals who faced financial hardships, contracted COVID, or those struggling with mental health disorders prior to the pandemic were more at risk. Harvard psychology professor Luana Marquez hopes to see a more in-depth study.
It's reminding us that it's not an all or nothing, and that perhaps the prediction of a tsunami may not be as large. I still think it's a little early to know long-term consequences.
Back in Brampton, as Ontario reopens, Bradshaw notes a positive change in his students and himself.
Ultimately, adaptation is part of the job when you're working with young people all the time.
Resilient, he says, and ready to return to in-person classes in the fall. Jamie Mauracher, Global News, Toronto.